We're going to switch gears for you. The U.S. is seeing a rise in the popularity of weight loss drugs like Ozempic and Wegovy. The increase is being driven by celebrities and those viral social media videos showing dramatic weight loss transformations. But the high demand is also squeezing supplies for the diabetic patients. Ozempic is FDA approved for type 2 diabetes patients, but can be prescribed for weight loss. And Wegovy is approved by the FDA for people with obesity who are also at risk of heart disease. Editor-at-large for Public Health at Kaiser Health News is Dr. Céline Gounder. She joins us at the table. She is, by the way, our CBS News medical contributor. It's always good to see you in your signature scarves, I have to say. So we're going to talk about the weight loss drugs in just a second, but let's start with picking up on the story from Chris. The earthquake in Turkey. As a public health official, what are your biggest concerns when you look at that health-wise?
After the initial injuries that people would sustain in an earthquake, you're really looking at a few other things that we would worry about. So one is dialysis, because people don't have electricity to run the dialysis machines. Yeah. And you can't really go very long without dialysis if you are somebody who's has kidney disease and needs dialysis. Sepsis is another one. So with these injuries people might have had, maybe they survived the earthquake, but they have skin abrasions, other things, could even be unrelated to the earthquake, that they have an infection. And because they're not able to get rapid care, that can go on to sepsis.
Yeah, I mean, we're watching you because the crews, as you see, are working 24/7, but it's heartbreaking. It's the imagery that we see and the sounds that we hear that get to me, but the whole bigger story there with the health issues. Let's talk about the weight loss drugs, because people who have struggled with a weight issue, and I'm a member of that club, the struggle is real, always keep thinking, I wish there was a pill that I could take. And now there is a pill that you could take, but you have a but to that.
So Ozempic and Wegovy are both injections you would take once a week. They do work very well as long as you're on them, and that's the hitch. So how do these work? They stimulate the pancreas to make more insulin. They make you feel fuller faster. They reduce your appetite. But again, if you're not on them basically for the rest of your life, the weight comes right back on.
Is it feasible to be on them for the rest of your life?
These drugs are really expensive. So you're talking about $15,000 a year. So if you're a celebrity who makes millions of dollars a year, yeah, maybe you can afford it. But for the average person, it's really unaffordable. Medicaid, Medicare don't cover these drugs. And then even private insurance, regular insurance, may not cover these, especially if you don't meet the very strict criteria in terms of diabetes and some of these other heart risky conditions.
Dr. Gounder, I wonder this. I have a couple of friends who take it. They're not a diabetic, right? They're doing it just for the aesthetic reasons. And here's what I wonder. Will they be more dependent on it if you stay on it for beauty reasons? In 10 years, are we going to find out, well, maybe you're more prone to diabetes because you did that?
We don't know. People talk about worrying about the long-term risks of vaccines. We really don't know the long-term risks of drugs like Ozempic and Wegovy. So in 5 years, will they be dependent on them? Well, at least for the weight loss part of it, absolutely. We see people regain the weight within a year and sometimes much faster than that. Wow. There are other long-term risks of being on these drugs. So we see an increased risk of pancreatitis, so it's inflammation of the pancreas, gallstones, kidney disease. And in rodents, we have seen an increased risk of thyroid cancer.
So it can mess with your pancreas if you're not a diabetic? Is that what you're saying?
Well, the way it works is to stimulate your pancreas. So anything that can stimulate your pancreas could also cause inflammation of the pancreas. So that is a risk with these drugs.
Mm-hmm. What about in the short term? I mean, obviously, one of the side effects, the one that people are going for, is you lose weight. But do you feel any kind of discomfort in the meantime?
Yeah, nausea, vomiting, diarrhea. Some people really can't tolerate these drugs because the nausea is so bad. So it depends. Some people can tolerate them, some people can't.
Should this be something that insurance covers, or is this sort of like, it's an aesthetic thing, as David said? It's not really health.
Well, for some people, it is a health thing. So, for diabetics who have high blood pressure, high cholesterol, and other medications don't work. But 40% of Americans are obese. And if you had to treat at $15,000 a year 40% of Americans, you're looking at trillions of dollars, more than we already spend on healthcare. So it's not feasible to do that. So I really think insurance companies are going to be pretty strict in terms of who they're going to cover this medication for.
But if you're sitting here and you're watching the results, the social media videos are amazing. If you're looking at the results and you say, I'm willing to take that chance, do you think it's worth taking that chance?
Unless you can afford to spend $15,000 a year out of pocket for the rest of your life, look, the weight's going to come raging back on.
But it comes raging back on, Celine, regardless of what you do. You're talking to someone who's been on the hot dog diet, the cabbage soup diet, the fast diet, Weight Watchers, all of it.
Yeah.
But it does come back on if you don't do the right thing.
No, but if you
don't
really,
you think?
You have to stick with the habits, that really help you with the weight loss, which is especially what you eat.
I know.
Absolutely, that's the.
We all know what we have to do. We just don't.
We don't want to do it.
It's very hard. It's very difficult. But I mean, if you really want to sweat, though, $15,000 a year is
Yeah,
a
that's a
pretty
lot.
heavy
That's a
burden.
lot.
Dr. Céline Gounder, thank you very much for walking us through it.